Nursing shortages are common. We know that in healthcare, there have been constant changes and complexities in the healthcare setting. Patients are sicker. We have more students that are graduating. That's med students as well as nursing students that need really good preceptors. So, what can we do as nurse educators to help not only equip our nursing students with the knowledge they need, but how can we educate our community? So, here's one question that we often hear being asked: can all students really learn? And the answer is yes. We know that all students can absolutely learn. However, there are some key elements that we as the educator want to take responsibility for. This is a partnership. I like to tell students that as much as we would love to say, just come to class and we will make sure that the content you need to know about, you're going to have the answer to on the exam. We know that's not the case. It's impossible for us as educators to teach every single concept and really facilitate. That's our goal, to facilitate a discussion about all the concepts that students will need to know about. I wish we could. However, as an adult learner, there's a responsibility that students have as well. And that's what we're going to talk about. How do we collaborate? How do we partner so that students are successful and they're able to make these safe patient care decisions that are so important after they graduate? Well, welcome back, everybody, to Dr. Sellars Educate. We are an accredited provider by ANCC. All of the content within our courses, within our structured program, is eligible for contact hours. Now, this is an important point. We don't talk about it a lot, but this means that we have specific standards that we have to meet, right, in order for our content to meet the ANCC guidelines. We take this very seriously, not only because we believe in following the evidence, but also it's important for you because you're spending time with our programs and you're engaging in this conversation to help transform your teaching strategies along the way. So the question is, can they really learn? This is a question that we pose to you. Can all students in my classroom learn? And if not, what's getting in the way? How can we support them to move forward? Okay, so let's take a look at our thought-provoking question, and then we'll come back to that question. Can they really learn, and how can I support them, and what does that look like? A nursing program affirms the belief that all students can learn and report strong engagement and course pass rates. However, faculty note that a subset of students consistently underperform in simulation and clinical judgment focused assessments despite passing written exams. Which faculty action best reflects the belief that all students can learn while remaining aligned with the NLN Nurse Educator Competencies? So we have A, maintain current assessments and reinforce that students are responsible for independently closing performance gaps. B, modify some summative evaluations to reduce cognitive complexity and improve overall student success rates. Or C, provide structured formative assessments with targeted feedback to support progression towards competency outcomes. All right, so when you get to the CNE exam, you want to think about, what is this question really asking me? And number two, what is it that I know for sure about content in this question or concepts in this question? Now I'm in a simulator. So if you're like me, you're going to take some time to really process what this question is really even talking about, right? Because there's a lot of content, a lot of language, a lot of terms in this question. But don't let that distract you when you get to the CNA exam. Stay focused and being clear about what this question is asking you. And if you need more time, you can just pause. That's the beauty of YouTube, or if you're listening to us on the podcast, you can easily just pause and come back, okay? But we're going to keep going. All right, so if you chose as the correct answer C, you are correct. Providing structured formative assessments with targeted feedback to support progression toward competency outcomes is going to be the best strategy to take. And let's talk about why. So C, it actually aligns with the NLN competencies by using assessment for learning. We want to use both formative assessments and summative assessments. And I do get this question often from students. It feels like we're testing a lot, and how are we making sure that learning has happened? Well, that's what assessments actually do. So perhaps there's an opportunity for us to connect the dots more tightly with our students so they understand assessments really give us information. It gives us feedback as to whether or not those objectives have been met. And What additional work do we need to do to help improve student success, right? That's what this is about. Not only student success in the classroom, but students' ability to provide safe patient care, to make safe patient care decisions so we can decrease our mortality, decrease our adverse events associated with hospital errors. A assumes readiness rather than assessing and developing it. And B prioritizes pass rates over demonstrated competence, weakening outcome integrity. And listen, none of us want that. We want to maintain the standards of our nursing programs at a high level, not only because we know NCLEX pass rates are an indicator of our programmatic outcomes being met, it's also important for students to be able to validate students' competencies related to providing safe patient care. So again, that's the rationale for C being correct and for A and B not being correct. Now I wanted to take a little bit of time to go through that deeper because yes, we get excited when you choose the correct answer. However, it's most important that you understand the rationale for the incorrect and correct answer. This is another thing that we know about the C&E exam. There's very few questions, less than 30% of questions will be at that lower level, right, of recall or remembering for the cognitive learning domain. You're going to take a look at pages 188 through 190 in Billings and Halstead, 6th edition. You will see three important elements. Number one, you're going to see the definition of all three learning domains. Number two, you're going to see the pyramid, that Bloom's taxonomy, where we should scaffold learning over time. For cognitive, remembering recall is that lowest level. There is some element of recall and memorization that students are going to engage in, but they can't stay there, right? We have to scaffold or build on prior knowledge up into the highest form of cognitive, which is creating. Okay, so that's what you want to think about when we're developing assessments, both formative and summative. We got to develop that blueprint first, and we have to follow that blueprint to truly engage and identify learner readiness. Now, this is a part that we own. How are we preparing our learner to be ready, right? To be ready to engage in these formative assessments from day one. So what does that look like? Well, if students have a prereq, as an example, for pathophysiology, when they get to Med-Surg 1, we want students to have some deep comprehension of that cardiac system and what happens when there's a myocardial infarction, as an example. We can't simply expect students to understand blood flow. They have to get to a point where they understand what can impede blood flow, and most importantly, how do I recognize those cues, right? What do the vital signs look like? What does that patient's mental state look like? And then next, what am I going to do about it? If students don't recognize those cues, they can't identify interventions or what next steps can be. They can't prioritize because they don't know that anything is wrong, right? So assessing our learning readiness requires us to equip, first of all, ourselves in using those tools that are going to identify when a learner is ready. Second of all, to help students get ready. What do I mean by that? Engaging in Socratic inquiry, Socratic questioning. I attended an excellent workshop yesterday on exactly that. And you may think, aren't you a content expert? Well, that's a great question. We all engage in continuous quality improvement. And I loved the two examples she gave. Okay, so you all tell me in the chat. When we're engaging in Socratic questioning, we are using open-ended questions to dig deeper into the knowledge level of our students. Okay, so an approach I could take is, if I ask the student, do you have any questions? Is that an open-ended or a closed-ended? Do you have any questions? Okay, so if you guessed closed-ended, you're right, because the answer is yes or no. However, if I say, what questions do you have? Right, that is a prompt. I'm starting to think, I probably should have questions since she's saying it like that, right? What questions do you have, right? That's open-ended. That's a way to engage in Socratic inquiry, which I love that term. So that's what you want to think about. How am I engaging in this Socratic questioning to help my learners get ready? Am I going over 100-page or 100-slide PowerPoint? Or am I asking students to get into think, pair, share circles where they're pulling literature articles? identifying 3 key points that align with the objectives, and we're having meaningful discussions about specific content that's lending itself to context. What do I mean by that? Well, we are developing and designing unfolding case studies in a way that brings in the concept of myocardial infarction, the disease process, so students can really get to the root of understanding blood flow, impact to blood flow, and what am I going to do about it? How does that patient present? Instructional responsibility, that's what we're talking about. Engaging in open-ended discussions, engaging in using evidence-based practices, just like Chapter 16 in Billings and Halstead's 6th edition talks about. I'm using peer-based learning. I'm using Socratic questioning. I'm using case studies, right? I'm using some lecture because I am engaging in some pedagogy, which means that I'm the content expert. I want students to understand these are the steps in sterile technique, right? There's no deviation because we want to decrease nosocomial infections, right? We don't want to give patients infections and make it harder for their recovery period. So saying all students can learn isn't a belief, it's a responsibility. It's our responsibility to partner with the students to help them learn, and it's their responsibility to take advantage of all the great resources. We hope that this snapshot has been helpful as you think about what your journey is going to look like. We know that learners, every student is capable of learning. The question is, how are we engaging them on this learning journey? We look forward to seeing you in our snapshot. Make sure you check out our website, drsellarseducate.com. We look forward to seeing you in the next snapshot and in our future program. Have a great one, everybody.